So welcome back everybody. My name is Franz Pfeiffer. I'm a professor for medical physics and X-ray physics at the Technical University in Munich. And I want to discuss a bit with you the role of medical imaging technology development, in particular photon counting detector technology, in the fight against corona, so COVID-19 detection. In a previous discussion, we already found that the role of medical imaging, in particular computed tomography, is actually a nicely complementary one to the presently used PCR testing, because CT offers very fast and immediate results about the patient's state, and therefore already gives you a good hint at the diagnosis of COVID-19 when you see specific patterns. And secondly, compared to PCR tests, CT imaging also allows you to do staging of the patient. So not only figure out that he has COVID-19, but also see in the lung the changes and potentially also improvements during therapy or the time he spends in the hospital. We also saw that there are two problems still, issues associated with the presently used CT technology. First of all, it's about the specificity. So we see actually similar patterns in the CT scans for several different infectious lung diseases and not just for COVID-19. So we do not have a very precisely determined diagnosis. We see that there is an infection, but we are not totally sure that it's COVID-19. And the second thing, of course, with CT scans always, we do apply a certain dose to the patient. Although low today, in the region of 2-3 millisievert, it's still a dose, and you cannot use that just repetitively as often as you like and in a general public screening program. So now I want to discuss a little bit with you how photon counting detector technology may actually change this picture in the future. Photon counting detectors offer two specific advantages of present-day technology. First, these detectors are essentially noiseless because they count every single photon, no electronic noise, and that means that you can actually make them with a very high resolution without having to pay the dose penalty term for every readout. And the second thing is also that they offer, of course, the spectral additional information, and that means that they can actually discern the photons in different energy bins. And I think both of these key features can be very helpful for improving present-day X-ray imaging in the clinics. Let's first look at the high resolution. If we had higher resolution in pulmonary CT scans, I think that we actually would have a real potential to discern between the different disease patterns. So we might use artificial intelligence or some other form of feature detection in these images, and that could actually help to discern some infectious lung diseases from COVID-19, and in that way get actually a little more certainty, or in medical terms specificity, about the COVID-19 diagnosis. The second thing I think that photon counting detectors can offer is connected to the spectral abilities of these detectors. In a present-day radiograph, which we are not using for COVID-19 detection, we cannot really see very clear fine details in the tissue because typically we have the bone structures overlaying the whole image. Radiographs would be great because the dose is factor of 50 or 100 smaller than in a CT image, but as I said today, it's not really used because of that. Now when we use photon counting detectors in a radiography setup, if we could do that, then we would have the possibility to actually separate the different parts of the body. So we could have a virtual bone image and a virtual soft tissue image. And I think that if we then combine this with a high resolution, we might actually have a real chance to get a little more information in the tissue-only image, and might then actually be able to diagnose also COVID-19 in the radiograph and not in the CT image. And that would mean that we could have a much lower dose. As I said before, typical radiographic doses are in the order of 20, 30, 40 microsievert instead of 3-4 millisievert for a CT scan. And that would then mean that we could have a tool that is widely applicable without having to think too much about the dose that we apply. So I hope that you got a little bit of an impression what photon counting technology might bring for COVID-19. And I hope you also appreciate what medical imaging in general helps in the fight against the coronavirus. Thank you very much.